Yes, I want to say that requiring the hepatitis B vaccine for infants instead of kindergartners, we already require it for kindergartners, it's not reasonable because the vaccine causes harm, and it's not needed because the incidence is so low. I am a former registered nurse, a public health nurse, and so I was a big supporter of the vaccination program. But I am sad for my profession today because I feel that our medical system has not given credence to these parents who have experienced vaccine injury in their children. We've dismissed them. We've said that their experiences are coincidence. And we've gone along with an expansion in the vaccine program. I know as nurses, we don't want to recognize that we maybe hurt somebody. And when we do a public health program, we have a goal to eliminate a disease. And that's a noble goal. But we have to keep in mind an even greater and more important goal, and that's the overall health of all of the people in the community, not just one or a number of infectious diseases. And so if a vaccination program to eliminate hepatitis B is successful and eliminates the disease, but it leaves in its wake a number of injured and dead people, then it shouldn't be required for people to participate in that. Vaccine is not a treatment for a disease. It's a preventive intervention. And as such, it could accidentally harm people that never would have gotten exposure to the disease. As a result, the standards of safety for a vaccine need to be much higher than they are for our medical treatments when somebody has a disease. And making it a mandate by the state, even with an exemption option, requires an even higher standard of safety. If we're going to require a vaccine for children, this has to be safe. The hepatitis B vaccine does not reach that standard of safety. There's different ways of documenting harm from the hepatitis B vaccine. We've talked about the VAERS system. Oh, that's a little chart about a goal of eliminating disease, and then a more important goal is the overall good health of the population. Okay. Chris rightfully pointed out that the VAERS data do not prove causality, but they are important data. And we know that since the hepatitis B vaccine was introduced, there have been over 66,000 adverse events reported to VAERS, including lots of things like brain inflammation, multiple sclerosis, Guillain-Barré, lupus. There have been 1,500 deaths. When we talk about VAERS, whether it's reliable or not, a lot of people feel that reports to VAERS are actually grossly underreported, and that's because doctors are reluctant to report a reaction to a vaccine as a reaction to a vaccine. And we hear this from parents all the time. Doctors say, oh no, it couldn't have been a vaccine, and they don't report it. And so a lot of people feel that the number of adverse effects is really much larger than in VAERS. We did a study of how many reports have been made to VAERS from Minnesota, and particularly from Minnesota children ages 0 to 5. And we see that in Minnesota children ages 0 to 5, there have been 240 reports of adverse reactions. And when we think about that, if we space that out over 20 years since it's been recommended for babies, that means that that's about 11 reports per year. So that means that almost every month, a child in Minnesota has a serious enough reaction to this vaccine that somebody reports it to VAERS. 11 per year is more than the number of new cases of hepatitis B in children every year in Minnesota. So this means that a child is more likely to have a reported adverse reaction to the hepatitis B vaccine than to contract the disease. Of those reports, 90 Minnesota children were sent to the emergency room. 25 were hospitalized. So these are serious reports. 6 Minnesota children death was reported following the hepatitis B vaccine. Every report that's put into VAERS has some notes that the nurse or doctor can record. And this is one note for one of the deaths. The baby died in the car ride home. No preceding symptoms or signs. 9:42 a.m. just back up a second. Here's some other quick examples of reports from VAERS. I'll just read real quickly. Unresponsiveness, pale and lifeless, would not respond to us all. Cause documented as reaction to immunization shots. High-pitched, weak cry, patient color was pale, ashen, unresponsive. Pneumothorax, that means collapsed lung, bilateral, means both lungs. Apneic, which means they stopped breathing. Pancreatitis. So I gave you the links in the report, so you can feel free to go to those reports yourself and take a look at them. And one of the handouts I gave you, this is the actual reports following the 6 deaths in Minnesota infants following the hepatitis B vaccine. So you can read those very quickly. Okay. Another source of information about harm from a vaccine is the National Vaccine Injury Compensation Program. This is a federal program that's set up to compensate individuals who are recognized to have been harmed by a vaccine. And unlike a VAERS report, which is passive and it doesn't prove causality, this investigation is detailed and strenuous. Just ask the parents who have gone through this process where it takes years and documents upon documents to try to ascertain, was it really the vaccine that caused it. Multiple court rulings have awarded people for autoimmune diseases, death, inflammatory disorders of the brain and nervous system, acute disseminating encephalomyelitis, autoimmune diseases such as rheumatoid arthritis, lupus, and fibromyalgia. So there have been 262 people nationwide that have been compensated by the court for severe injury or death following the hepatitis B vaccine. Over 25 years, that's an average of 10.5 people every year. So vaccine injury from the hepatitis B vaccine is common enough that almost every month another person is recognized by the federal court as needing to be compensated for injury from this vaccine. This is not rare injuries. They are happening all too frequently. Here's an example of the court's ruling where they said not only did the decedent have a vaccine injury, but also her death was vaccine related. So it's not reasonable to require a vaccine with such a track record of harm for anyone, especially not babies who are the most vulnerable to vaccine injury. In addition to evidence from VAERS and evidence from the vaccine court, we have clinical studies. And in this handout I gave you, I documented just the conclusions of just a small handful of these studies, but many of them have concluded things like recombinant hepatitis B vaccine may trigger the development of rheumatoid arthritis. Hepatitis B virus vaccination may induce severe reactions requiring the use of a long-term treatment. Study after study. This handout that I gave you is a partial list of adverse events following hepatitis B vaccination references from the medical literature. It's single-spaced. Every line is a different report, and it's 6 pages long. And it's all kinds of autoimmune and long-term chronic problems. And when I look at this, and then I hear the statements from the sonar or from clinicians who say, this vaccine is safe. And there's some disconnect here. Parents are not informed of the risks of this vaccine. The Institute of Medicine did an exhaustive review of the safety of vaccines recently. And they looked at every vaccine and its relationship to, all kinds of diseases. And what Diane said in her testimony was that, I have this in quotes, there's no evidence that the immunization schedule is unsafe. So I read quite a bit of that exhaustive statement from IOM, and I was particularly looking at hepatitis B, so they would say, okay, how about hepatitis B and lupus? How about hepatitis B and multiple sclerosis? and then they would have a statement for each one. And over and over and over in like every situation, what they actually said was, the evidence is inadequate to accept or reject causation, proof of causation. And so what they were really saying was, well, we don't know. There's a lot of evidence on one way, there's evidence on the other way. We're not saying, we can't say. We need more study. His name is Michael Belkin, B-E-L-K-I-N. My daughter, Lila, died at the age of 5 weeks, 15 hours after receiving a hepatitis B vaccine. She was alert, healthy, lively when I last held her in my arms, and she died that night. She was never ill before receiving the hepatitis B shot that afternoon. At her final feeding that night, she became agitated, and then she fell asleep suddenly and stopped breathing. The medical examiners ruled her death sudden infant death syndrome, or SIDS. But the medical examiner in his report did not mention that her brain was swollen. And SIDS is a diagnosis of exclusion. If you say, well, it wasn't this, it wasn't that, everything's been ruled out, we don't know what it is, then it's SIDS. But swollen brain is not an illness of exclusion. She had a swollen brain, and swollen brain is a really common thing that is noted in vaccine injuries. He said that when he asked the New York City coroner to report his daughter's hepatitis death, he did, but that VAERS never returned his call. And one of the things he has found as a national spokesperson now for people with vaccine injury is that that happens all the time. And that VAERS does not follow up with parents when it is reported. I mean, the officials today said, well, these are really monitored and people follow up and they study it. Parents reported nothing, no follow-up. He wrote a long testimony to Congress where he did a lot of research on these issues, and I have submitted his full testimony to Congress on this.
Excellent. Thank you so much, Ms. Johnson.
So I was making a case that it's not true that the hepatitis B vaccine is safe. In fact, there's a record of so many people that have been seriously injured and killed by it, and that's undeniable. I don't know if I put on the PowerPoint the package inserts for the hepatitis B vaccines. Okay, so Paul, it's about.
So what page is she on?
I don't know that.
Just tell me when to stop.
Yeah. Okay, back up another one. Okay, so I want to talk a little bit about the safety studies that are done by the pharmaceutical companies that profit from the vaccines. And in the package insert that I included in the packet for you to look at, it says there, so-and-so number of people were administered this vaccine, and they were monitored for 5 days after each dose. And that's the standard for vaccine safety studies. They monitor people for 5 days. And so they have no chance of finding out that some children get juvenile diabetes from the vaccine, or asthma, or rheumatoid arthritis. Because all of those things, autoimmune diseases, develop over time, and they do not try to look for that. It's so important that when you do a safety study for a vaccine that you use science to determine if it's safe. And we all know that the gold standard of science is if you want to give something to see people and see if it's safe, is that you give it to a group of people and you monitor them for adverse reports, and then you give a placebo to another group of people and you monitor them, and then you compare the two and see which one are there more adverse events in the injection group. When pharmaceutical companies do safety studies on vaccines, they don't do that. If they have a placebo or control group at all, that group gets a different vaccine. And so in both groups, you'll see a spike in admissions to the emergency room, you'll see a spike in asthma attacks, a spike in seizures, but it happens in both groups. And so if the experimental vaccine is not greater than the other vaccine, they literally conclude no adverse effects were noted in this vaccine. And I haven't submitted this, but I could submit this to you for a different vaccine, the pneumococcal vaccine, where that evidence is there. Now you cannot get the safety studies from the pharmaceutical companies that manufacture these vaccines and did the safety studies. You can't get the raw data that shows this. All you can get is their summaries where they conclude no serious adverse effects. So the safety studies don't follow the people long term. And when they do a safety study, they select who the people are going to be in a safety study, and they only select healthy children. They screen out all of the ill and vulnerable children, people with any kind of immune system problem. They're not going to be in the test group. So the healthy children get the vaccine, and then it gets approved as safe, and then it goes out into the general public and is given to every baby, regardless of their status of their immune system. And we don't know if it's safe for those sick babies. We do know from small studies that compare vaccinated to unvaccinated children that unvaccinated children have way less chronic illness. That there's a group in Illinois, a medical doctor, whose practice has treated about 50,000 children, most of whom have never been vaccinated. And the insurance companies have contacted him and said, you know, we're kind of confused here. None of your kids have asthma. None of his kids have autism. His kids don't have juvenile diabetes. A study that was done in Minnesota on Amish children found almost 0 cases of autism in Amish community except for 3 cases, and all 3 of those were adopted and had been vaccinated. Most of the Amish community does not vaccinate. And so we desperately need to have this kind of vaccinated versus unvaccinated study. And as somebody's pointed out, it's the group that is opposing having a study like that is the CDC, pharmaceutical companies, the departments of health. I'd like to talk a little bit about the need for this vaccine. Requiring the hepatitis B vaccine is not needed because the incidence of the disease is so low and it is consistently dropping. Let's go back to that slide, Paul. Parents are not informed of the risk of the vaccine, so I need to step forward in my... I'd like to talk about this question of exemptions, because I think that's a crucial issue, and the question of whether the state has the right to mandate a vaccine, given that we have an exemption option that's available to anybody. And so then that would bring up the question, well, can the state just then mandate any vaccine they want? After all, parents can exempt out. So can the state mandate a vaccine that isn't needed because there's hardly any disease in the state? Can they mandate a vaccine that's really, really dangerous and everybody recognizes that it's dangerous? Because parents can opt out. And I think the answer to that is no. I think the state still has to look at the issue of, is this vaccine needed? Is there an epidemic that's threatening people? So you need this. And is this vaccine reasonable because it's safe? It still has to be considered. I think that the fairness of an exemption option is dependent on parents receiving truthful information about the safety of the vaccine. And if you look up on the screen, here's the information that parents are given on the VIS, the Federally Mandated Vaccine Information Statement. Hepatitis B is a very safe vaccine. Most people do not have any problems with it. Severe problems are extremely rare. And so parents are never told of all of the people who have been disabled and killed by this vaccine as admitted by the vaccine court that has compensated them. They are given the impression that not to worry. And so is the exemption option even valid for those parents? Secondly, what if we had a totalitarian regime come in, and the exemption options would disappear. And a movement is happening across our country to roll back exemption options in states. So what if you go ahead and mandate this vaccine, and you say, well, it's okay to mandate it because we have exemption. 20 years from now, the exemption goes away, but the vaccine schedule stays there, and it's harming people, and parents have no way out. You have a responsibility to not mandate it if it's not safe. We asked, some years ago, I think it was maybe when you were in the legislature, I was working on a bill to have doctors disclose to patients before they gave a vaccine that there was mercury in the vaccine. And the Minnesota Department of Health opposed that bill. And they said, literally, I should go back and get the quotes and apologize. But the gist of it was, we don't want parents to know that there's mercury in vaccines. It might give the impression that there's something wrong with injecting mercury into infants. And so they opposed that bill. We worked on it for 4 years, and were never able to pass it. And I bring that up because I think that's an issue of disclosure to parents of the truth. And if you're not disclosing the truth to parents, then the exemption is not relevant because the parents aren't making an informed decision. Okay, then I'd like to talk about the need for the vaccine because of the low incidence of this disease. If you look at this chart from the CDC, the incidence of hepatitis B by age group, hepatitis B in infants is almost zero. Nationwide, the incidence of acute hepatitis B has decreased from a high of 11.5 per 100,000 population to 1.3 per 100,000 population in 2008. Extremely low. That's for acute hepatitis. It's dropped particularly sharply in children because of the programs that we have had working on this. And so incidence among children has declined 94%, from 1.1 per 100,000 to 0.36 per 100,000. In Minnesota, it's even more rare. Minnesota is one of the lowest, and I have the statistics in this.
And Ms. Johnson, what would you attribute that success to?
We've done a lot of work with the age groups where hepatitis B is primarily transmitted, and there was frustration with that because they felt, well, we're not being able to contact these groups very well. People with a lot of sexuality, the drug use injection. But in 1988, we instituted a program to test all pregnant women for hepatitis B. And all those women who were detected to be positive, as soon as their baby was born, the very day the baby was born, they were given immunoglobulin, and then they were given vaccinations for hepatitis B. And it's since that time that the incidence has just plummeted. And this is an effective strategy. It's reducing the incidence of hepatitis B in children, and as they're growing up and as they go to kindergarten, they will get, it's mandated for them to get the immunization if they haven't gotten it. It will protect them as they come into their teen sexuality years or drug use years. So we have good programs in place. They are working, and statistics are continuing to drop every year. Okay, this chart shows you the incidence of chronic hepatitis B in Minnesota by age group. There are 0 cases of acute hepatitis in Minnesota children, but there are 27 cases of recorded chronic hepatitis in Minnesota children between the ages of 0 and 4. So that number, 27, includes all children who have ever had any incidence of infection. They may not be ill, they just had the laboratory evidence from blood tests. 27 cases in 4 years, so it's a 4-year age group, equates to an average of about 7 cases per year. 7 cases per birth cohort of 70,000 babies. So 7 out of 70,000 is 1 in 10,000, or 0.01% of Minnesota preschoolers that are known to be infected with hepatitis B. So if you look at that chart and you can see where the 6-year mark is, at the 5-year mark, that's when all the babies are already mandated to get a hepatitis B vaccination to get into kindergarten. That's the current statute. So this proposed rule wants to roll that back to infancy entrance into daycare. And when we have so little, close to 0 number of cases in children, and it's not needed, those children are not likely to be exposed to hepatitis B. The goal is to protect those babies from getting hepatitis B before they turn 5. If you look at that 27 number, about 7 per year in Minnesota that have chronic hepatitis B, a lot of them, most of them, are actually babies who were born to mothers who had hepatitis B. The babies got it perinatally. They were treated, but the treatment did not work in their case. And so they do have chronic infection, and so they are listed as part of that statistic. Right now, it's 15 out of the 27 got hepatitis B that way. So this proposed rule to vaccinate all the healthy babies of hepatitis B negative mothers would not have prevented those 15 cases. So when you subtract that 15 from the 27 total cases, there's 12 babies in 4 years, in 4 birth cohorts, that got the infection somewhere else, an unknown place. That means 3, an average of 3 every year. And so we would need to vaccinate 70,000 babies in order to prevent 3 cases every year, or vaccinate 23,000 babies for each case that we prevent. In the process of vaccinating those 23,000 babies to prevent 1 case, it's a high risk. Some of those babies are going to be adversely affected by the vaccine. We already know from the VAERS reports that there's more reports of adverse injuries from the vaccine than there are cases in Minnesota. And so the risk that a child faces is greater from getting hepatitis B vaccine than from getting in contact with somebody with hepatitis B and getting the illness. So I think a lot of countries do not require a hepatitis B vaccine for infants, even though it's been available for over 20 years. Finland, Denmark, Norway, Sweden, Netherlands, they all say hepatitis B vaccine is only given to the infants of the mothers who are infected. And so a real reasonable strategy is to be screening all women, all pregnant women, and we do that. We screen every pregnant woman who's getting medical care and treat those babies. But to vaccinate all the babies of those mothers who turned out to be negative, they don't have hepatitis, is it's just government overreach. It's putting those babies at risk, and it's not reasonable.
Concluding thoughts?
Pardon me?
Concluding thoughts?
Yeah, I could give you concluding thoughts, but they would be repeating what I've already said.
Okay.
I think we have a good strategy in place that's working.
Okay.
We don't need another rule to require more.
I'm grateful for your time and contributions to our record.